You break your arm today, and within an hour someone sets the bone, wraps it in fiberglass, and sends you home with painkillers. Your ancestors did not have that hour. They had a forest, a fire, and whatever their hands could find. And somehow, thousands of them survived injuries that should have killed them. How? Long before hospitals, before antibiotics, before anyone understood what a bacteria even was, humans were already fighting the same battles you fight when you get hurt. A fall from a tree, a bite from an animal, a cut that would not stop weeping. The body has always tried to kill infection on its own. The question is what your ancestors did to help it win. Start with the bones. Paleopathologist Eric Trinkhaus spent years studying the skeleton of a Neanderthal, known as Shanidar one, found in a cave in northern Iraq. This man had a shattered arm bone. He had a crushed eye socket. He had injuries that, on their own, should have ended his life within days. But his bones did not just show damage. They showed healing. Years of it. Someone kept him alive long enough for that bone to knit back together. Think about what that means. Not medicine, not surgery. Care. Before any tool existed to diagnose a fracture, humans could see it with their own eyes. A limb bent the wrong way. A bone pushing against skin that was never meant to stretch that far. And their instinct, the same instinct you would have today, was to straighten it. Splinting is not a modern invention. It is closer to a reflex. Archaeologists have found evidence of splints made from tree bark, bound tightly with plant fiber or animal sinew, pressed against broken limbs to hold them still. Egyptian mummies from as early as 3000 BCE have been discovered, with linen splints still wrapped around healed fractures. The materials were different. The logic was identical to what an emergency room does now. Immobilize the break. Let the body do the rest. But setting a bone was the easier problem. Infection was the real enemy. Here is something your body does every single day without you noticing. When a wound opens, bacteria rush in almost immediately, invisible and merciless. Left alone, that wound can turn from a scratch into something that spreads through the bloodstream and kills within a week. Ancient humans could not see bacteria. They had no microscopes, no germ theory, nothing resembling modern science. What they had instead was thousands of years of trial, failure, and observation passed down by word of mouth. And somehow, some of what they discovered actually worked. Honey is one of the oldest wound treatments on record, used by ancient Egyptians, Sumerians, and Greeks alike. It seemed strange, almost superstitious, smearing something sweet onto an open wound. But honey has a low water content and a naturally acidic pH, which makes it hostile to many bacteria. Modern researchers studying wound care have confirmed what ancient healers stumbled onto through instinct alone. They did not know why it worked. They just noticed that wounds treated with it were less likely to fester. Moldy bread is another one. Ancient Egyptian and later medieval texts describe applying moldy bread or moldy plant matter directly onto infected wounds. That sounds almost backward, using something rotten to fight rot. But certain molds naturally produce antibacterial compounds. It would take until the 20th century for Alexander Fleming to isolate penicillin from a mold and reveal exactly why that ancient instinct had merit. The ingredient came first. The explanation came thousands of years later. Bioarchaeologist Charlotte Roberts, who has spent decades examining human remains for signs of ancient disease and treatment, has pointed to something remarkable in the skeletal record. Certain healed wounds show clear evidence that they were treated, not just endured. Edges smoothed, infection contained rather than spread. Somebody, somewhere, was making decisions that worked. Now here is where it gets even stranger. Some ancient humans performed surgery. Real surgery on living patients, without anesthesia, without sterilization, and in many cases, the patient survived. It is called trepanation, the practice of cutting or drilling a hole directly into the human skull. It sounds like something out of a horror story, and yet archaeologists have uncovered trepanned skulls from cultures spanning Peru, France, and parts of Africa, some dating back over 7,000 years. What makes this discovery genuinely astonishing is not that people attempted it. It is that many of these skulls show clear signs of bone regrowth around the hole. That means the patient lived, sometimes for years afterward. Nobody fully agrees on why ancient people performed trepanation. Some researchers believe it was meant to relieve pressure after a head injury, an oddly logical response to swelling inside the skull. Others believe it was tied to belief systems, an attempt to release evil spirits or unbearable pain. Maybe it was both. Maybe survival and belief have always been tangled together. Before this video goes any further, ask yourself something. If you had to treat a broken bone right now, with nothing but what is around you, would you even know where to start? Drop your answer in the comments. It says more about how far medicine has come than you might expect. And if this kind of history genuinely fascinates you, hitting subscribe means you will not miss where this story goes next. Pain relief is another piece of this puzzle. Ancient humans were not simply enduring agony in silence. Willow bark, chewed or brewed into a bitter tea, appears again and again across ancient Egyptian, Sumerian, and later Greek medical texts. Willow bark contains a compound called salicin, which your body converts into something remarkably close to modern aspirin. Thousands of years before a pharmaceutical company patented the pill in your medicine cabinet, someone was already chewing on a tree to dull their pain. Even cleanliness, something you might assume is a purely modern concept, shows up earlier than expected. Wine and vinegar were used to rinse wounds in several ancient Mediterranean cultures. Both are mildly acidic and can slow bacterial growth. Ancient healers likely had no concept of bacteria at all. What they had was pattern recognition. Wounds cleaned with wine seemed to heal cleaner than wounds left untouched. That was enough reason to keep doing it. Not every ancient treatment worked, of course. For every honey dressing that fought infection, there were remedies rooted purely in superstition, offerings to spirits, or outright harmful practices that did more damage than good. Ancient medicine was not a hidden trove of perfect wisdom. It was a mixture of genuine discovery and desperate guesswork, refined slowly over countless generations of people who had no other choice but to try. And that is really the point. Every splint, every application of honey, every skull carefully drilled and later healed represents somebody who refused to let another person simply die from something survivable. Community, not technology, was the first medicine humans ever had. Long before doctors existed as a profession, there were simply people who paid attention, who remembered what worked, and who passed it on. This is worth sitting with for a moment. The instinct to care for someone who is broken, physically or otherwise, is not a byproduct of modern civilization. It appears to be something far older, stitched into human behavior since before recorded history. Shanidar I did not heal his own shattered arm. Somebody fed him. Somebody protected him from predators while he could not move. Somebody made the decision that his life was worth the effort. If a piece of this history stood out to you, a like helps more people discover it, and a comment tells this channel exactly what to dig into next. Modern medicine likes to draw a hard line between the past and the present, as though the operating room and the cave are two entirely separate worlds. But look closely and the line gets blurry. Splinting a fracture, cleaning a wound, managing pain, relieving pressure on an injured skull. These are not new ideas your doctor invented last century. They are ancient survival instincts, sharpened over thousands of years, eventually dressed up in white coats and given Latin names. So the next time you walk into an emergency room and someone sets a broken bone in under an hour, remember that the instinct behind it is not new technology at all. It is something your ancestors already understood, carved in bark, brewed in bark tea, healed in honey, and proven true in bones that survived long enough to fossilize. You did not inherit modern medicine. You inherited the will to care for the injured, refined over 100,000 years. One healed bone at a time.